Thanks everyone for joining today. This is Dr. Milan, nurse practitioner located in California, United States. I know many of you are coming from, a lot of places around the world. So thank you for joining. This is Wednesday. We have Thanksgiving here in the United States tomorrow. So it's a busy time, and I know um, people are definitely wanting to know more about how they can sleep better. And I titled this Snooze or You'll Lose, and I'm going to convince you that sleep is really important to your health. So, of course, we're going to have some animal pictures of cute little animals sleeping. Happiness consists of getting enough sleep. Just a reminder that the information that's presented is educational only, and we cannot substitute this information as medical advice, and that we have not established a relationship as a patient or provider. And that, of course, we always encourage you to seek out professional help when you're wanting guidance for your own health issues, because, of course, what's happening to you is different than happening to somebody else. So whatever I'm presenting is sort of generic or general material that might not apply to you. So getting the help of a health professional would be really important. So over 1/3 of the US population sleeps less than the recommended 7 hours. We definitely want people to be sleeping 7 to 8 hours. And it's increasing. In fact, 10% of American adults prioritize their sleep over other aspects of daily living, such as fitness, nutrition, work, social life, hobbies, and personal interests. We've definitely become work oriented in the US, and sleep is not as much of a priority. Rest is not as much of a priority. And we're seeing a lot of medical issues because of that. And I would argue that this is happening around the world as well. I mean, my family I have family located in India, and I see that they're working harder and sleeping less as well. So, and I'm sure many of you around the world are seeing that in your cities as well. And all the research shows that a lack of sleep can affect your blood pressure, your heart rate, mental status, hormones, your immune system, and then oxidative stress. And we're going to talk a little bit about what that is. Uh, adverse effects of sleep. We know that short sleepers in the research, that's less than 7 hours, are more likely to have chronic health conditions like depression, arthritis, diabetes, or asthma. What's worse is that the shorter you sleep, the shorter you're going to live. Recent findings suggest that people who sleep in less than 6 hours have a 12% increase risk of dying prematurely relative to those who are getting 6 to 8 hours of sleep. There's also studies where they deprive rats of sleep. I know it sounds cruel, but it actually leads to death. So sleep is an essential function of your body for rejuvenation. We also know that sleep is related to anxiety and emotions. There was a 2018 study where they found out that sleep loss can actually trigger anxiety and vice versa. That you know that you really need sleep in order to possibly help anxiety. And then we can do brain scans and see what sleep deprivation does to people. And it activates these areas of fear, anxiety in the brain. And there's sort of not this emotional regulation in the medial prefrontal cortex, which is about emotions. Um, we also have done studies on like healthy young people, and have deprived them of sleep, and then we find there's a 30% rise in anxiety compared to how they felt the night before. So sleep is really important to regulating anxiety and emotion. Now, sleep can also cause DNA damage, and that's where we're talking about oxidative stress. Um, Researchers in 2019 evaluated the effects of acute sleep deprivation in Clinicians, yeah, we do a lot of shift work, and so it's easy to do studies on healthcare providers. And we see that there's a huge shift in their health because just one night of sleep loss in doctors causes more breaks in their DNA. And that the authors of this research study suggest that these molecular changes explain why sleep deprivation could be linked to increased cancer, metabolic disease, and Alzheimer's. So, again, a lot of research and data that sleep is important to health. And so, if I hopefully have convinced you at this point that it's really important to sleep, and what can you do? How do you improve your sleep? Again, cute little kitty. We see kids and pets are really good at sleeping and resting. So, we need to be more like them. So of course, uh, my approach has always been sort of a whole person systems approach, and the research shows these areas are helpful in solutions to sleep: mindfulness, mind body therapies, of course, adequate nutrition, and then there's supplements that can help you sleep properly or get you on a better pattern, and we're going to talk about that. I'm a functional medicine provider. I'm a nurse practitioner. And so our model is on sort of an individualized, patient centered science approach where we work together to address what's the root cause. Why aren't you sleeping? And so we want to really understand that from a genetic, biochemical, lifestyle factor. And then we take that data and come up with a treatment plan that's personalized. And this really targeted approach improves outcomes, especially for sleep. And of course, when we're improving sleep, as I've just shown you, we're improving lots of other medical issues. And that's probably one of the first areas I work on with my clients. So, one of the first things that I really like to talk about and educate my clients on is mindfulness exercises. And mindfulness is, there's a lot of different kinds of mindfulness. And I always think of mindfulness as just being really attentive to what you're doing, whether it's mindful sitting meditation or mindful eating or appreciation meditation. There's also loving kindness meditation. There's mindful walking, which is the kind of movement that I do. Um, and in a 2015 randomized clinical trial, when we examined the effects of mindful awareness practice, we saw improvements in sleep quality, which was better than actually a sleep hygiene education program. So we saw improvements in sleep-related depression and fatigue. So again, lots of studies. This was published in JAMA. So a lot of studies showing how these kind of mindfulness practices can improve health. The next sort of set of research studies was a 2019 systematic review, a meta-analysis, meaning it's basically looking at a lot of studies. We had 4,506 participants, and they looked at meditation, Tai Chi, Qigong, yoga. Also, these are all mindfulness uh, modalities, but they're mind body therapies where you have incorporate movement and the body and the mind. And these were very effective in treating insomnia and improving sleep quality for healthy and sort of chronic disease patients. The therapies resulted in statistically significant improvement in sleep quality and reduction in insomnia severity. Interestingly, Qigong was better than Tai Chi. And, Qigong is a little different. You're doing the same movement over and over again, whereas Tai Chi, you're kind of moving through a series of movements. So I think there's certain Qigong movements that can help with certain systems and body parts. So this is what they found. I think any of them would be fine. My favorite is yoga, and I'm a big yoga believer. My family's from India, and so of course there's a lot of yoga's been around for a very long time. And there was a 2018 study that found yoga reduced the disturbance of sleep in PMS patients. And we also know, women suffer with PMS and perimenopause and menopause, and there's a lot of sleep issues due to fluctuations in hormone levels. So yoga is a really powerful way to help that population. Research has proven that, and I think I would argue for any population, yoga would be great for sleep. There were studies on cancer survivors, and of course, 51 to 90% of cancer survivors experience some form of sleep disturbance. And so in 2019, there was a trial where they did a yoga therapy program on cancer survivors, and they found improvements in sleep quality and reductions in daytime dysfunction. So, again, statistical significance of yoga and how it improves sleep, and of course, greater reductions in sleep medications compared to controls, which improve the efficiency of sleep. So, yoga, what a great way to improve your sleep, doing some yoga exercises daily. Again, these are quick things that you can do, practical things that you can do to improve sleep. Now, of course, I think food is medicine, and these are powerful, you know, foods that can help with these nutrients that help with sleep. And we have the omega-3 fatty acids, the antioxidants, the B vitamins, magnesium, and of course, melatonin. A lot of people have heard of melatonin. And here are some food sources for each of those nutrients that are really helpful to sleep. We have a lot of the fish, mackerel, cod liver, salmon, chia seed, and flaxseed if you're vegetarian or vegan, antioxidants, all those brightly colored fruits, red, a lot of red and blues, blueberries, strawberries, raspberries, kale, and red cabbage. B vitamins, again, we're looking at the fish, the salmon, leafy greens, organ meats, eggs, milk, something there for any type of food, kind of food program you're on. Magnesium, really important, and that's in dark chocolate, bananas, avocados, beans, and nuts. And then melatonin, that's in milk, pistachios, fatty fish, rice, oats, and tart cherry. A 2020 review, randomized placebo-controlled trial conducted through 2019 assessed sleep quality in the intake of two melatonin food sources, milk and cherry juice, in adults and elderly. And there were about 8 studies that this analysis looked at, and they said that melatonin helps with healthy sleep, and these foods work. So definitely take a look at food as a way to improve your sleep. Now, what are some things that I am encouraging? Oh, my slide is not advancing. Let's see what's going on here. Okay, there we go. What are some natural ways to improve sleep? And I think the sleep habits are really important. You want to keep a regular schedule, go to bed at the same time and wake up at the same time. Last night, I ended up working late and, of course, went to sleep late and then woke up, had a hard time waking up. And, of course, my sleep was disrupted and I didn't sleep very well last night. So, having that regular schedule and keeping to it and really honoring that. I had a really late work night meeting, and so that kind of threw me off. And I told the other people in the group, I'm not a really big fan of meeting late at night. Let's meet in the morning. And they all agreed. So trying to make changes like that sometimes can help you get to bed. And sometimes it's not possible, but if you can do it, most of the time you're going to see improved sleep. Waking up to sunlight within an hour of waking. I think this is really important, which will help maintain your circadian rhythms. And we're going to talk a little bit about cortisol and melatonin, but I think it's really important. These circadian rhythms and having these routines really help maintain sleep on a regular basis. Your body gets into a rhythm of sleeping properly. Caffeine is a big issue. And of course, people are going in for their venti lattes at, Starbucks. And I think this can be a disruptor to regular sleep. Most of the time, we want to encourage you to have caffeine before noon. If at all, if somebody's having sleep issues, I actually tell them to eliminate caffeine for a month and see if they can improve their sleep naturally that way. Creating bedtime rituals, I love to kind of curl up to some tea, and we'll talk about some herbs that are great for that, or having a nice book to read that helps people feel sleepy. Having a face mask or a bath, and winding down, having sort of the lights down and creating a environment. We're going to talk about that in a minute. And then, if you're really hungry, eat some protein. Don't have carbs because those are a little more activating. There's that cute little cat with the mask. So creating a sleep sanctuary is really important, an environment that is conducive to sleep. A lot of people have all the lights on, they're watching, you know, their room isn't really comfortable, it's too hot. So these are some things that will help. An eye mask, having blackout curtains, earplugs, cotton sheets, a weighted blanket. Keeping the room cool is really helpful, so you don't want to have a really warm room either. And then I love lavender. I use lavender oil. I have a spray that I use to kind of go to bed at night. I just spray it around my bed, and that helps me kind of relax. And then having the routine that I talked about, dimming the lights. A lot of people are watching TV right before they go to bed or on their phone. I think this is a big issue. The blue light can be really activating to the brain, and makes it hard to wind down. And I don't know if, I've done this sometimes. I'm on TikTok, and looking at my TikTok before I go to bed, and next thing you know, I'm watching TikTok videos and I can't stop. And I think part of it is the addictiveness of just looking at the videos, but part of it is the stimulation. And I'm like, oh, but I'm not sleepy. I'll just look at one or two more videos until I feel sleepy. And then it never really happens. So keeping your phone away, I've often talked to clients about putting their phone like in another room, or putting their phone away from their bed, maybe in your bathroom, something where you're not having that phone right next to you. Sleeping before midnight is really important. It's been shown to be twice as potent as the hours after midnight. So getting to bed at a decent hour, somewhere between 10 and midnight, sounds good. 9 to midnight, of course, even better. And we're going to talk a little bit about supplements. And another option is to just have a journal next to your bed. And I do this. I write down notes of things that I did during the day, things that I felt gratitude for. These help you wind down, sort of end the day on a good note, feel good about what you've accomplished, and that sense of relaxation and accomplishment. Let's talk about supplements. This is a big, 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 big question that I get asked a lot, and I think there's a lot of information out there, a lot of medications out there for sleep. Obviously, this is a big issue in our country. We have a lot of pharmaceutical drugs for sleep. I would say people should be very careful of taking a regular pharmaceutical medication prescription. They can be addictive. And, from a functional medicine perspective, they don't address the root cause. Why aren't you sleeping well? Let's figure it out. Let's get you changing habits so that you do sleep better, instead of relying on a medication to sleep. And whether that's your caffeine or your sleep sanctuary, not having a sleep sanctuary, or if it's a lot of anxiety during the day, stress raises cortisol, and cortisol and melatonin balance each other out. So cortisol rises in the morning and kind of decreases towards the end of the day, and melatonin rises at the end of the day. And melatonin is a powerful antioxidant. So this is what you need to sleep. You need it to heal. You need it to recover. And that's why it increases at night. And so you can take melatonin, and that's available over the counter. Typically 3 milligrams is enough for sleep. But sometimes people say melatonin isn't working, and that's probably because cortisol is on overdrive. So another medicine that I like is ashwagandha, because it really does help stabilize cortisol, help stabilize that stress, and that can be enough to help get to sleep at night then. And you take the ashwagandha during the day. The other really great supplement that you can get over the counter is magnesium. I really like the Calm, which is at Costco now. If you know what Costco is, that's a big store here in the US. So I can get a big tub of magnesium citrate from Costco. The product is called Calm. And I take a scoop of that at night and feel great. I really like it. It helps sleep. It does have some bowel symptoms, so it can give you a little bit of a looser stool in the morning if you like that. If you don't like that, that's a consideration. There are other forms of magnesium. Magnesium threonate is great for sort of the brain. Magnesium glycinate works in a lot of different ways. So those are two other options for magnesium. A lot of people are using over-the-counter medications like diphenhydramine or doxylamine, and these are anticholinergics. They dry you out. They sort of have also antihistamine properties, but they're linked to dementia. So I would not use those. And then if you put them with like an Advil PM or a Tylenol PM, you're getting a unnecessary pain reliever. And those are really strong pain relievers, have their own side effects on the liver and kidney and stomach. So I really stay away from those Advil PMs or Tylenol PMs or antihistamines. Benadryl is diphenhydramine. I think they're not great in the long run and should not be used long term. If they're used once in a while, it's fine. And then, depending on, of course, your health conditions. Big fan, big fan of teas. I love teas. I love herbal teas and herbs. Um, these are some herbs: passion flower, hops, lemon balm, chamomile, and lavender. Great herbs for relaxation. Do help with sleep and anxiety. And these are available over the counter in tea form easily. You can nice little ritual to have a cup of tea before you go to bed and have some relaxation and a time to wind down. So these are some things that you can try for sleep supplements. And of course, I would talk to your medical provider before using any of these. Make sure that they work for you and your other medications that you're taking, if any. But all of these are over the counter and available to anybody. But again, check with your medical provider before taking anything. And so that concludes my presentation on sleep. I hope you got some great perspective on how uh, natural approaches can help with sleep and how important sleep is and how important it is to work with someone improving your sleep because it will help improve your health and longevity. Of course, I'm a functional medicine provider here in California, and I'm happy to help anybody who needs it. And of course, here's my information: info@lotusintegrativehealth.com. Our phone number is 408 337 2767. And I am offering a free 15-minute consult to anybody. You can go to our website and sign up. It's very easy, and I can talk to you about what your medical issues are and what you're trying to improve, whether it's sleep or other issues. I work with anyone and everyone. I am specialized in women's health, but have plenty of male uh, male clients as well. So, or female, or non-gender, or binary, whatever your background is. I'm here to help you, and of course, located in the U.S., but happy to help people abroad as well. So, thank you so much for attending my webinar. I'm going to just check and see if anybody has any questions. There is a Q&A available. If you have any questions, I'll give it 1 minute. And if not, we will conclude the presentation. Thank you for attending.